Friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we can see the next set of questions for exam preparation, and we already completed first 60 questions, and today we can see the questions starting from question number 61. We will see the question one by one. First question, a client is to begin a 6-month course of therapy with isoniazid. A nurse plans to teach the client to. Options are option A, use alcohol in small amount only. Option B, report yellow eyes or skin immediately. Option C, avoid vitamin supplements during therapy. And option D, all of this. Here question is, a client started 6-month course of isoniazid. For that client, what education does the nurse will give? That is the question. So here have to know what is the side effect of this isoniazid, then we can easily answer this question. The main side effect of isoniazid include hypersensitivity reaction, peripheral neuritis, neurotoxicity and hepatotoxicity. Hepatotoxicity means increased liver test level all, and also nausea, vomiting, dry mouth, dizziness, vision changes all will occur for the patient who is taking isoniazid. Okay, so here patient client, we have to told the client to report signs and symptoms of hepatitis immediately to the physician or to the nurse. Okay, so the signs and symptoms mainly include color changes of the urine or skin color or sclera, so that we have to report immediately. That client has to report immediately, that we have to educate the client. So here we can see isoniazid is an anti-tubercular drug and is hepatotoxic. Therefore the client is taught to report the signs and symptoms of hepatitis immediately, that is color changes, yellow skin or sclera, and also urine changes. So here option B is the correct answer, that is report yellow eyes or skin immediately, that is the correct answer. And also option A, use alcohol in small amount, that also we have to taught the client. The main priority is report the yellow eyes or skin immediately, and we have to advise the patient to minimize or avoid alcohol, that also we have to do. And another one important side effect is this peripheral neuritis can also occur to the patient who is taking isoniazid. Okay, and we'll see the next question, question number 62. Which test is contraindicated in a woman with antepartum hemorrhage? And the options are option A, USG abdomen, option B, amniocentesis, option C, vaginal examination, option D, all of this. Our question is, which test is contraindicated in a woman with antepartum hemorrhage? That is the question, and the correct answer is option C, vaginal examination. So during the time of antepartum hemorrhage, if we are again doing vaginal examination, there is a chance of bleeding only. So we have to avoid vaginal examination during the time of antepartum hemorrhage. And the next question. Question number 63. A client with myocardial infarction suddenly becomes tachycardic, shows signs of a hunger and begins coughing frothy pink tinged sputum. Which of the following would the nurse anticipate when auscultating client birth sound? And the options are option A, stridor, option B, crackles, option C, scattered ronge, option D, diminished birth sound. Here question is, client with myocardial infarction silently shows the signs and symptoms, and while doing auscultation, which birth sound does the nurse can hear? That is the question, and correct answer is option B, crackles is the correct answer. Here we have to know one of the life-threatening events that can occur in myocardial infarction or heart failure is pulmonary edema. Here they are given the signs and symptoms, that is tachycardic and shows a hunger and begins coughing and frothy pink sputum. All are the signs and symptoms of pulmonary edema. So we have to know the pulmonary edema, then we can answer this question easily. Pulmonary edema is characterized by extreme breathlessness, dyspnea, a hunger and production of frothy pink tinged sputum. And during auscultation, the lung reveals crackling sound in case of pulmonary edema. So here correct answer is crackles is the correct answer. Here options wrong and diminished burst sound are not associated with this pulmonary edema, and stridor is there. This stridor is associated with laryngospasm or edema of the upper airway. Here crackling sound is here when patient with pulmonary edema. It is one of the life-threatening complication occurs in severe heart failure. Question number 64. In a neonate, the normal blood glucose level is. Options are option A 30 to 45 milligram per deciliter, option B 45 to 90 milligram per deciliter, option C 80 to 120 milligram per deciliter, option D 120 to 140 milligram per deciliter. Here question is the normal blood glucose level in neonate is, and the correct answer is option B 45 to 90 milligram per deciliter is the normal blood glucose level in neonate. Question number 65. Raynaud syndrome is caused due to the use of. Options are option A paracetamol, option B aspirin, option C diclofenac, option D salbutamol. Your question is Raynaud syndrome occurred due to the use of which among the following medication? Okay, and the correct answer is option B. Aspirin is the correct answer. Aspirin, which causes Raynaud syndrome, is an inflammatory condition of brain and liver. Raynaud syndrome means it's one of the inflammatory condition of brain and liver. Question number 66. Which of the following food should be avoided while taking aspirin on empty stomach? And the options are option A coffee, option B milk, option C apple juice, option D brand rice. Our question is which among the following food items should not be taken while taking aspirin on empty stomach? Okay, and the correct answer is option A coffee. Coffee should be avoided during the time of consumption of aspirin on empty stomach. Option A is the correct answer. And the next question. Question number 67. Newborn maturity rating is done by using. Options are option A Apgar score, option B calendar score, option C Bellard score, option D none of this. Our question is newborn maturity rating is assessed by using option C Bellard score is the correct answer. Bellard score is used to assess newborn maturity rating. And the question number 68. Blood group referred as universal donor is. And the options, option A group O, option B blood group B, option C blood group AB, option D blood group A. Our question is which is the universal donor blood group? Correct answer is among this option A is the correct answer, blood group O. Here universal donor is O negative and universal recipient is AB group, and the blood group with no antigen is group O, and blood group with maximum number of antigen is group AB. Okay, here our question is universal donor. Universal donor is O negative is the correct answer. Here option A. Question number 69. The longest bone of our body is. And the options are option A skull, option B radius, option C humerus, option D femur. Question is which is the longest bone in our body? And the correct answer is option D, femur is the correct answer. And the longest and strongest bone in our bone is femur, and also heaviest bone in our body is also femur. Longest, strongest and heaviest bone in our body is femur. Okay, here our question answer is option D, femur. And the next question. Question number 70. The normal hemoglobin level is. Options are option A 18 to 23 milligram per deciliter, option B 14 to 60 milligram per deciliter, option C 8 to 10 milligram per deciliter, and option D 16 to 20 milligram per deciliter. And here correct answer is option B, 14 to 16 milligram per deciliter. And the normal hemoglobin level for an adult is 14 to 16 gram per deciliter, and for female it is 12 to 15 gram per deciliter. Here our question is normal hemoglobin levels. Normal in general, normal is 14 to 16 milligram per deciliter. Question number 71. Normal blood glucose level of an average adult is. Options are 80 to 120 milligram per deciliter. Option B 80 to 210 milligram per deciliter. Option C 60 to 100 milligram per deciliter. And option D 150 to 200 milligram per deciliter. Here normal blood glucose level for an average adult is option A 80 to 110 milligram per deciliter. Among this option 80 to 110 milligram per deciliter is the correct answer. Normally normal blood glucose level in fasting is 70 to 110 milligram per deciliter, and after, that is postprandial, it is less than 140 milligram per deciliter. That is the normal. Question number 72. Covering of the heart is known as. Options are option A peritoneum, option B pleura, option C pericardium, option D myocardium. Here question is which is the covering of the heart, and the correct answer is option C pericardium is the correct answer. And the remaining option we can see the peritoneum. Peritoneum is the serous membrane which line the abdominal cavity, that is peritoneum. And pleura is there. Pleura is also a serous membrane which line the lungs and thoracic cavity. And option D myocardium. Myocardium is the middle muscular layer of the heart is known as myocardium. Here our question is covering of the heart. Covering of the heart is known as pericardium. Okay, and here option C is the correct answer. And we'll see the next question. Question number 73. Color coding of oxygen cylinder is. And the options are option A blue, option B black, option C black with white shoulder, option D yellow. Question is the color coding of our oxygen cylinder, and the correct answer is option C black with white shoulder is the color coding of oxygen cylinder. And the remaining option blue, the nitrous oxide cylinder is blue in color, and yellow chlorine cylinder is yellow in color, and our oxygen cylinder is black with white tip. Okay, option C is the correct answer. Question number 74. The blood pressure of a normal healthy person is. Options are option A 110 by 60 mmHg, option B 120 by 80 mmHg, option C 90 by 60 mmHg, and option D 140 by 60 mmHg. And the question is normal blood pressure of a healthy person is option B 120 by 80 mmHg. If the blood pressure above 140 by 90 is considered as hypertension, and below 90 by 60 is considered as hypotension. Here our question is normal blood pressure is 120 by 80 mmHg, and the option B is the correct answer. And the next question, question number 75. Normal intraocular pressure is. Options are option A 8 to 21 mmHg, option B 16 to 25 mmHg, option C 20 to 25 mmHg, and option D 19 to 38 mmHg. Normal intraocular pressure is 8 to 21 mmHg is the correct answer. Option A is the correct answer. 8 to 21 mmHg.